Action. Hello, I'm
Hi.
Dr. Todd.
Nice to meet you.
Nice to meet you. Nice to meet you. Oh, crap. Shut it off for a second. I forgot my coat. Hello, I'm Dr. Todd.
Nice to meet you.
Hello.
Hi,
What's your name?
Jordan.
Jordan. It's nice to meet you. Well, I've come in to talk to you and your mother about, we've ran some tests and it's been confirmed that you have exercise-induced asthma. Do you know anything about that? No? Okay. Well, I'm going to try to tell you a little about it and what you should do and maybe what you shouldn't do. Most patients have asthma sometimes, or maybe not at all. And what it is when we go outside and exercise for about 10 minutes, or after we've stopped exercising, sometimes we start coughing or wheezing. Have you ever had that problem? Okay. Well, that's what this is, one of the symptoms. And what this does is, this is because when we exercise, take deep breaths and fast, and we're usually doing it through our mouth. And when it's cold outside, when we're breathing through our mouth, we're really breathing a lot of cold air in dry area, and that can cause spasms, which can lead to asthma episodes. The patient should always, they sometimes induce inflammation in the airways, and they produce extra mucus, and that can cause the coughing and wheezing and the tightness of the chest. And what this usually does is usually happens when it's around 55-degree weather or colder, or when there's dry weather or air. And when people have this, like asthma or allergic reactions, when you exercise, it contributes to the coughing and the wheezing and tightness of the chest. Do you understand any of that? No? Okay. That's fine. But what we're really wanting to do is, for the safety of you, what we want you to do is teach you how to be able to exercise appropriately so you can have all the fun you can. And what I want to do is teach you a few things. And what it is before you go out and exercise or go play, I'd like you to warm up inside. Run around a little to where your body speeds up its heart rate and all that. And second, we'd like to teach you, if you can, and instead of breathing through your mouth, we want you to breathe through your nose. Because if you breathe through your nose, when you breathe that cold air in, it warms it and adds moisture to it. So when it gets to your airways, it helps keep it moist and warm, so you don't have any problems. Because if you do it like if you breathe through your mouth, it has a tendency to breathe in cold air, and that will actually contribute to spasms that will lead to more what is called asthma episodes. And we do this sometimes, unfortunately, if we can't control it that way, then we may have to prescribe a medication like a relief inhaler. Have you ever heard anything like that? Okay, that's fine. We'll teach you a little more about it later. But when you take these, they actually, if you have any problems, they usually start about 5 minutes, and they'll actually maximize their strength within 15 minutes. And they last about 4 to 5 hours. So what we want you to do is, if you will, is before you ever go out and exercise, if you need a bronchodilator, is take it 20 minutes before you go out to exercise. You want to take about 2 puffs, and it'll probably be like albuterol, Ventolin, or Zopanax. And what we want to do is to remember is that when you go out and exercise, like for football, or if it's like track, because it's outside and when it's cold, that's when it really will affect you the most. I can tell you that for sure. Because if you're playing inside, you usually don't have too much trouble getting the exercise-induced asthma. But there's 3 things I want you to try to remember, if you can. One is before you go out and exercise, is try to play around in the house a little and get a little workout. That way you can speed up your heart rate. And number 2 is, while you're out exercising or playing, is to breathe through your nose so you don't have any problems of getting any spasms. And the third, of course, would be the last, is make sure to take that bronchodilator 20 minutes before you go out and play. That's That's what I'd like for you to see or do, okay? Do you have any questions? Do you have any? Well, I'm going to have some other colleagues come in and to actually break it down a little more simpler, like the peak flow or the small volume nab for the albuterol. Is that okay?
All right.
Thank you.
Thank you very much.
Thank you.
Take care.
You also.
Good morning, ladies. My name is Brian.
Nice to
Miss
meet you.
Smith and Jordan, pleasure to meet both of you. Now, I know Dr. Todd's been talking to you about some issues that you're having when you exercise and when you breathe, or some potential problems for your breathing when you exercise. What I have here is something to help with that. All right, this is a therapy or a treatment. This is called a metered dose inhaler, or sometimes we'll call it an MDI. For Mom, for your purposes, what that means is that metered dose inhaler means that this little device, it's an aerosol, and it's going to send a metered amount of medicine out through that as I actuate it, and we're going to direct that into Jordan's lungs so that she can get the effect of this bronchodilator. All right. For you, honey, that's a fancy way of saying I've got some medicine that we're going to shoot down into your lungs, and it's going to help you breathe easier. Okay. Does that make sense? All right. Any questions about that so far? All right. So basically, as I said, there's a specific amount of medicine that comes out of this each time I squeeze it. Okay, Jordan, I want you to watch as I fire. See that? See how that shoots that medicine out of there? Okay? Well, what we've got to do, rather than shooting it out into the air like that, we've got to get it directed in so that you can breathe it in and it can get all the way down so that it'll help you open up your lungs for you. Okay? The way we do that is the other device that I have with me, and this is called a spacer. All right? And what a spacer does is keep all that trapped in this chamber. We're going to hold it right up to your mouth, and then everything's going to go right on down your throat, right on down into those lungs, and open everything up for you. Okay? Everything good so far? So Jordan, what I'm going to do is teach you a little trick to make sure that we get this timed so that the medicine goes in. Okay? So what I'm going to do, and I'll pretend that I'm doing it on myself, I'm going to cheat, and I'm going to go blow out the candles, completely exhale, fire, and then take a deep breath and hold. Okay? Does that seem simple enough? So again, it's just blow out the candles, fire, and then take a deep breath. Okay? And once you take that deep breath, I want you to hold it. Okay? So let's try for you, all right? And what I'm going to do is, for this first time, I'll squeeze the trigger, all right, and then the next time you can do it. How about that? That'd be all right? Okay. So, right up to your mouth, good tight seal around your mouth. Blow out the candles for me, all the way out, all the way out. Fire. Deep breath and hold. Hold, hold, hold. Breathe normal. No, that wasn't so tough, was it? All right. You want to try to do it yourself this time? Okay, great. All right. So, hands on everything. Blow out the candles. Fire. Deep breath in and hold. Perfect.
Good job.
Perfect. You did a very nice job. All right. Any questions about that? Well, now, if I were you, I'd have questions about when do you think I ought to do this, right? Does that make sense? I think I'd want to know when I ought to do that. What I'm going to tell you about that is anytime that you think you're going to go out and you're really going to run or jump or play hard and really, really exert yourself, okay? So a mom, if she's got a soccer game or a basketball game or going to go run with her friends outside, whatever it might be, this particular medicine, this is called albuterol, it's going to take about 15 to 20 minutes for everything to achieve its full efficiency or efficacy, okay? So what we're going to want to do is think ahead and use our medicine before we go play, all right? It doesn't sound so tough, now does it? Now, what if we forget? What do you think? Think we can use it anyway? You can. You can go ahead and use it anyway, all right? It won't be as efficient, and it's always better to try and medicate ahead of time, but if you start to feel a little trouble, this is also sometimes what we call mama rescue inhaler. So if she's having some trouble, maybe she's got a cold and she's not feeling well and she's having a little trouble, a little wheezing or something like that, it could potentially be used in that instance as well, okay? This is a pharmaceutical product. This is something Dr. Todd will write a prescription for you, and he'll give you some very specific instructions about those things that we've talked about. How many puffs, how often she should do it, what scenarios she can use it in, and what to do if it's not working, okay? What she might need to do if it's not working, okay? All right, a couple other things about taking care of this MDI. It will, over time, it'll get a little dirty inside potentially. You carry it in your purse, or Jordan, you carry it in your backpack for school or something like that. You notice it has a cap on it, all right? Always want to keep the cap shut. You know why that is?
So it doesn't get dirty?
That's right. That's very good. So it doesn't get dirty. That's right. Think about if we had some lint from a sock in there or something silly, and you shot it, you knock that right down your throat. You see what I mean? So we don't ever want to do that, okay? So if it does get dirty, we can just take it out. Mommy can wash this in soap and water, shake it out, rinse it out, paper towel, good to go. This one we don't want to get wet, all right? And the reason we don't want to get it wet, it has a nice little counter on the back of it. You see that? And this particular inhaler starts at 200, and every time we squeeze it, it counts backwards until there's no more puffs in there, all right? Now, it's very important that we think about that, because this will feel like there's still medicine in it, but it'll be completely empty, okay? So we always want to make sure that we're watching that counter and make sure that we've got everything we need, okay? Any questions for me? All right, well, I'm going to excuse myself. We've got some more colleagues who are coming in. They're going to teach you about some other things that you need to know, okay? Thanks for listening.
Thank you
All
very
right.
much. That seemed to work.
Hi. Hi, I'm Lindsey. I'm a respiratory therapist. Are you Jordan? Hi, Jordan. Nice to meet you.
Hi, nice to meet you.
What's your name?
I'm Beth.
Beth. Okay. Jordan's mother?
Yes.
Okay. Well, I am here to tell you about the peak flow meter. I don't know what you know about the peak flow meter, but I will pretend you don't know anything. What it does is it's going to measure how fast you're exhaling. So this is because if you're exercising or having an asthma attack, your lungs kind of close so that you're not going to get much air in and out. This is going to let you know when you're having a possible asthma issue, okay? When you need to take medicine, or when you need to go to the emergency room. What we're going to do...
This is Jordan's brother, David.
Jordan's brother, David. Hi, David. So what we're going to do, we're going to make sure this indicator is at the down position, right like that. And then you're going to take a big breath in, as much air as possible in your lungs, and then you're going to make a tight seal with your mouth around the mouthpiece and blow it all out. Okay? So you're going to blow up your lungs, and then you're going to as fast as you can into the device. Okay? And that indicator is going to go into a level, and hopefully you're in the green zone, you know, when you blow out. But if you're not, it'll pretty much tell you what you need to do. So if it's in the yellow zone, you're going to take your medicine. You were just taught how to use your MDI with your spacer. That's what you'll do. You'll take the 2 puffs of your MDI if you're in the yellow zone. If you're in the red zone, that's when you need to get mom and tell her you need to go to the hospital, okay? Because your lungs are too far gone. The medicine isn't going to help you, okay? So I'm going to have you try. Do you think you can try it? Okay. So I make sure the indicator's all the way down. Fill up your lungs, tight seal, and blow. Very good. Okay. And what you're going to do, that's very good. You got in the green zone. So what you're going to do is do it 3 times, just to make sure that that wasn't a mistake, that you're going to get that 3 times in a row, okay? You're going to take the highest number, or the best rating that you get, okay?
Deep breath in.
Blow it out. There you go. Good job. You got in the green again. So we're going to try it one last time and just make sure that the reading hasn't changed, okay? Make sure you're still doing well. Okay. So all the readings got in the green zone. So that means you're doing fine and you don't have to take any medicine, okay? Unless you go out to play.
When do we do this?
You're going to...
Every day, before she goes out?
That's a great question. You're going to do this whenever you feel like you might be having an asthma attack. Okay.
So when she's not feeling great.
Exactly. Okay. I'm going to have another colleague kind of tell you a little bit more about what other things besides exercise might be able to trigger asthma attacks. She's going to give you some information, okay? All right, well, it was nice meeting you, Jordan. I'm gonna leave this for you so that you can take this home with you, okay? All right.
That looks like a fun toy. You wanna see it? You wanna hold it?
Hi guys, how are you?
Hi,
I'm Joniece.
nice to meet you.
What's your name?
Jordan.
Jordan, nice to meet you. I'm the asthma clinic educator. So basically I'm gonna just kind of refresh everything that the doctor and respiratory therapist have went over with you. I did bring some information for you. She's with Indiana IU Health. So I brought some information on our hospital, and I brought an asthma pamphlet. This will give you a complete overview of her condition, so you guys can take that home and take a look at it. I also have an action plan for you. This is outlined your name and the date and your doctor and his information. I've also listed some personal triggers that seem to bother you when you get into trouble with your asthma. I've listed pollen, cold air, or sport activity. So if you're going to do any of these activities, it's a good idea if you're going to be outside or playing a lot, it's a good idea to just take your inhaler before you go out and do these, about 20 minutes prior to. I've also listed for your peak flow the values. If you're in the green zone,
And
you're
that
going
was
to
this thing, right?
Okay. That's the peak flow. If she gets around 240, that means she's perfectly fine. Your yellow zone, where you might need to caution, is 120 to 192. At that time, she needs to take her inhaler. She needs to probably take a break from whatever activities she's doing and just monitor her for the next 24 hours. If she gets any worse, she would fall below 120, and that would mean you're in the red zone. At that time, you need to let your mom know, or your coach, or your teacher, let them know you're having a lot of trouble breathing, you're really short of breath. Some signs to look for are lips or fingernails turning blue or purple. That means that she is in dire need of oxygen, her lungs are closing up, and she needs to get to an ER immediately. Okay? And I looked in your file. You guys do have health insurance for her to get the medication. All right, awesome. If that ever becomes a problem, just contact me, and I can put you guys in line with a social worker, and they can help you out with that.
Okay, great.
Okay? Do you have any
Thank you.
questions?
No.
All right. Was everyone thorough with you?
Thank you very much.
Good. Thank
Alright.
you.
Yep.
There's
There's
your
yours.
action plan.
Thank you.
No problem.
I'm coming next.
I think we're all done.